Wasn't too much of a hurry. Tried to go around a corner a little faster than I should have been. I hit the side of a van at 60 miles an hour. I broke 14 ribs, all 12 on the left side, 2 on the right. I broke the elbow, I broke my hip, and at one point they actually had to put me on the blood bypass machine just to keep me going.
We heard we had a very severely injured patient who had sustained a motorcycle accident. When that happens, they activate a system that results in the immediate availability of a surgical team, an operating room, a group of emergency medicine doctors, a group of nurses and medics. Probably 100 people took care of him in that first 2 to 3 hours of his stabilization.
A lung removal after trauma is fairly serious business, and with him being a traumatic arrest, we already knew that the likelihood of his survival was very low.
When they had to actually take the lung out, they said there was less than 1% chance of survival of that surgery.
Particularly when you don't have both lungs anymore, we're able to put patients on a circuit that outside the body oxygenates the blood and then pumps it back in.
It was able to give my heart and lung enough time for me to be able to survive. I know if they wasn't put on there, I wouldn't be here today.
For us as trauma surgeons, we push the limits of the technology that we have because we know it's never 0%.
When you have physicians, when you have pharmacists, when you have respiratory therapists together taking care of the patient, one thing is clear, and it's that the patient's outcomes are better.
Everybody in that hospital was rooting for Dennis. I can guarantee that somebody that helped take care of him might even be a trauma surgeon in the future because of the impact that taking care of Dennis has made on them.
If I was taken to a different hospital, it may have been different results. But going to UC, they really did a good job.
After he was discharged here, he went to a long-term care facility in Kentucky. He then came to see us about a month after that discharge in the ICU recovery program, and he was almost fully recovered.
You know, I do have a daughter, she's 5 years old, I gotta take care of. There's a lot of push right there. Before the accident, you know, I would be the one to take her to daycare, pick her up from daycare, and then all of a sudden I just wasn't there.
I always end the session with asking people, you know, if there's one thing that you can get back to doing before your crash, what would it be? And the first thing he said was, I want to be a dad again. I want to be the dad that I was before. And that's what we've been trying to get him to do.
It's a miracle I'm sitting there today. It's a miracle I walked in here without a cane, a walker, a wheelchair. I mean, it's a miracle.